The deadly coronavirus pandemic has put the US under lockdown, but not Sweden. Are they doing it right? Welcome back to America Uncovered. I'm Chris Chappell. Here in New York and many other parts of the United States, we're entering the 7th week of coronavirus lockdown. At this point, I'm basically ready to kill my roommate. To be fair, I've been on the verge of that since way before the lockdown. I mean, leaving dirty socks on the television? How does that even happen, Carl? But lockdown measures have led to somewhat more serious problems, like 30 million people being unemployed. And that's just people who filed unemployment claims. Across the US, there have been protests against the lockdown. And people are asking, isn't there anything we can do? And now, people are looking to one man for the answer. What? No, not Trump. This guy. This is Dr. Anders Tegnell. He's basically Sweden's version of Dr. Anthony Fauci. And as Sweden's chief epidemiologist, Dr. Tegnell has taken his country on a very different path to handling the coronavirus. Namely, Sweden never locked down. That's right. Unlike every other European country, Sweden did not lock down. This is a park in Stockholm, Sweden's capital, a couple of weeks ago. And here's a restaurant. People typically aren't even wearing masks. In Sweden, shops, restaurants, bars, parks, and elementary schools are open. Do you hate them? Well, you shouldn't. It's not the Swedish people's fault that their government took a different approach. But before you go out of your mind with jealousy, life is not completely normal in Sweden. Gatherings of 50 people or more are still banned. High schools and colleges are closed, not that anyone would complain. And family visits to nursing homes are off limits. That last one came after several nursing homes in early April saw unusually high deaths from the coronavirus. So anyway, unlike the US and the rest of Europe, Sweden has not locked down their country, nor shut off huge parts of their economy to deal with the coronavirus pandemic. The most important question is, has it worked? Well, that depends on who you ask. If you ask left-leaning CNN, no.
More than 2,400 people have died here, vastly greater numbers than neighbouring countries which imposed much tougher restrictions.
But if you ask right-leaning Fox, Sweden is doing great.
And without locking down, Sweden, and this is the key, has fared far better than other European countries that did lock down. That includes Britain, Italy, Spain, Belgium.
Are you confused? So are a lot of people. That's because it's actually very hard to get a grip on how well Sweden has done. If you look purely at the data, compared to other European countries, Sweden looks like it's roughly maybe in the middle-ish. But even that depends on which data you're looking at. And the data can be cherry-picked by different media with different biases. For example, that CNN video showed the total deaths in Sweden compared to other Nordic countries. Those Nordic countries happen to have some of the lowest deaths in Europe, but they also have very small populations. Tucker Carlson on Fox, on the other hand, compared Sweden not to its neighbors, but to the European countries hit the hardest, like the UK, Italy, and Spain, which have a lot more deaths per capita. Both CNN and Fox showed accurate data, but it was different data, so they drew different conclusions. But even those conclusions can be misleading, because 90% of the people who have died in Sweden were elderly. And early on, Sweden had a problem with outbreaks at nursing homes, which is why Sweden banned visits to nursing homes on April 1st. It's like that drawing that's either a young lady or an old woman. It all depends on how you look at it. So should America adopt Sweden's approach? Again, it depends on who you ask. On the political left, they say, yes, America should be more like Sweden. Wait, no, sorry, that's a headline about socialism. I mean on the political right, they say, yes, America should be more like Sweden. Boy, how things change. But the truth is, America can never be exactly like Sweden. The conditions here are completely different. For example, compare population density. It appears Sweden has fewer people per square mile than the US. Except that's not true. The US has Alaska, which is huge and contains mostly moose. Mooses? Meese? But the US also has New York City, which is full of unhappy people sitting too close together on the subway. Sweden also has a subway, but people don't feel the need to be right up against each other or do showtime acrobatics in the middle of rush hour. This is a bus stop in Sweden last year, before the coronavirus. The Swedes were social distancing before it was cool. My point is, you can't simplify it as just being about population density. Nor is it about other simple things like wearing face masks. In New York, most people are now wearing face masks. But in Stockholm, even these Red Cross workers are not wearing masks. Are you confused again? So are a lot of people. Because the real problem is not population density or face masks or who has the most disgusting subways. That last one is clearly New York, by the way. The real problem is that we have absurdly incomplete data on the coronavirus, and that makes it impossible to draw accurate conclusions. That's right. No matter which data you look at, it's not complete enough to actually tell us for sure which way is better. We don't even really know how many people have been infected in the US or in any other country because most people aren't getting tested. And for those who do get tested, there's often a big selection bias. That is, people are more likely to go get tested if they already have symptoms or live with somebody who is showing symptoms. But the government may never get accurate data on the current number of infections. The US is now doing surveillance testing to try and see what percentage of the population has had the coronavirus. But there are many issues with that type of antibody testing that I don't want to get into right now. The important point is, there's a lag of several weeks. And it's not just the current rate of infection that's unknown. We don't know exactly how many people have died from the coronavirus either. When the Centers for Disease Control releases their data, a lot of it is 2 weeks behind, and it's constantly being revised. And it's clear that other health factors can affect how badly people get sick, things like obesity and diabetes. And those other health factors might be different between, say, the US and Sweden, where everyone looks like this. And the limited data we do have often raises more questions than it answers. For example, take these two counties in Southern California that are right next to each other. As of Friday, April 3rd, Los Angeles County had a per capita COVID-19 death rate 7.3 times higher than Orange County's. 7.3 times higher? That's the difference between a dangerous pandemic and a bad seasonal flu. As one epidemiologist said, some counties do well and some counties do poor. It's not exactly clear why. And even inside Sweden, there's a lot of uncertainty about their approach. Even if the lack of a lockdown is ultimately viewed favorably, it is also possible that other countries could not have taken the same path as Sweden. And remember Dr. Tegnell, Sweden's Anthony Fauci? He said that while the strategy had achieved its goal of stopping the country's health service from being overwhelmed, it was very difficult to know whether a lockdown could have prevented more deaths. So Sweden's chief epidemiologist, who designed the whole no lockdown strategy, still doesn't know whether it will turn out to have been a good idea or a bad idea. Because it turns out the only thing we can all be sure about is that we don't know. I'm sure of that. Thanks for watching. And please support America Uncovered by contributing through our crowdfunding website, Patreon. Go to patreon.com/AmericaUncovered to learn more. Once again, I'm Chris Chappell. Thanks for watching America Uncovered.